All right, let's talk about what the facility needs to look like. And I want to credit Chris Brummer from Patterson for giving me this diagram. They have some special design folks in their office that help with this. So you want to have generally, to run $1 million practice, about 2,000 square feet. That's a 5-operatory practice. So the 5 operatories, I think I have a laser on this, are right off the words are kind of hard to see, but, oh, the laser doesn't work. That's interesting. Right off the top there, are the 5 operatories. So you need 2 for the doctor, 2 for hygiene, and 1 kind of swing room for emergencies or another hygiene room. 5 operatories. You need a treatment consult room so that you can discuss treatment with the patient in a private setting, so you can talk about finances and how to make it affordable and what you can offer them. A private setting is nice for that. The doctor should have an office. There should be room for a staff break area. And there should be, what else do we have up here? And then a business office. So you need enough room for 2 people in a business office, like a scheduling coordinator and a financial coordinator. So that's generally what, if you're designing a practice or if you're at the start or you're ready to make a move, think about 2,000 square feet, think about 5 operatories. That's an ideal type of setting. How many people do you need? You need 7 to 8 people in $1 million dental practice. So there's the 1-1-1 model and the 2-2-2. For a $500,000 practice, 1 hygienist, 1 front desk person, and 1 dental assistant. For $1 million practice, you need 2-2-2. You need 2 dental assistants, 2 hygienists, and 2 front desk people. The way the front desk works, generally, you want to be clear about responsibilities there, is you should have a scheduling coordinator and a financial coordinator. Someone dedicated to making sure that schedule is full and it's aligned to the goal and it's working the way it should and you're taking advantage of the 2 operatories. And a financial coordinator who helps present the treatment, makes it affordable, keeps track of accounts receivable, follows up with patients, handles all the finances. That's how you would split up the business office. There's another way to do it with treatment coordination and hygiene coordination, but the first way works better, I find. You want 2 assistants, so there's an assistant dedicated to each to each operative room. The patient is never alone, and the doctor is never alone. That's how that would work. So each room always has an assistant in it. And then 2 hygienists working out of the 2 hygiene operatories, and that's 8 hygiene days per week, which you could actually cover more than 1,000 patients with 8 hygiene days per week. And then the hygiene assistant is a nice to have. That's something when you really get cranking and you're really full and you really look at your numbers and understand your overhead and you know you can produce more out of the hygiene department by having an assistant flip the rooms for you dedicated to flipping the hygiene rooms. That's when you can look at that. With 2 assistants, you'll even find that one of the assistants can sometimes help in the hygiene room as well. So that can also work. So you want to scale. That would be the 8th person that you add. You want to scale up to this. If you're at 500 right now and you have 1-1-1, 1 assistant, 1 hygienist, and 1 front desk, you may need to add another person just to break through the barrier. That may need to come first if you're already at $500,000 in production. So you can think about your staffing model.